Sending love, health, happiness, and prosperity to you watching this video. Welcome back to my channel. My name is Dr. Aisha. I'm a family nurse practitioner. And in this video, I'm going to tell you all about the levels of nursing. Because if you know nursing, you know it's levels to this. The first type of nurse we're going to talk about today is the entry-level nurse, and this is going to be your LVN or your LPN. LVN stands for Licensed Practical Nurse. LVN is going to be your Licensed Vocational Nurse. LPN is going to be your Licensed Practical Nurse. These are the same type of nurse. These terms are used interchangeably. It means the exact same thing. They take the exact same NCLEX to become a nurse. Okay, so this is going to be the entry-level nurse. There are approximately 676,000 practicing currently. These types of programs are certificate programs. You can get it in 1 year up to a year and a half, and they're going to provide basic health care to patients with predictable healthcare needs. Okay, let's go closer. Predictable healthcare needs. Supervision is required. They must be supervised appropriately by an RN or registered nurse, a nurse practitioner, or an advanced practice registered nurse. We'll talk about that a little later. A physician assistant or a physician. They're going to make around, on average, according to the Bureau of Labor Statistics, they make on average $48,070, but they can make up to $80,000. So this is going to be your first level of nursing, which is the LVN, the entry-level nurse. The second type of nurse is going to be your registered nurse. This is a level up over the LVN. The RN is going to be the most common type of nurse with approximately 3.1 million nurses practicing. You can become an RN with an associate degree, which takes between 2 and 3 years, or you can get your bachelor's degree. The traditional route is 4 years. You can get a bachelor's degree. They do have accelerated programs. I do have a video on that. Check that out. And where you can get a bachelor's degree in a year or a year and a half. The RN is going to provide care to patients and their families with complex healthcare needs, and they do not require supervision for RN practice. Now, the RN is going to make on average, according to the Bureau of Labor Statistics, $77,600, but the earning potential is crazy for an RN, and these nurses today are out here making upwards of $200,000. So, RN is the level up over the LVN, the second nurse. Now, I am going to do my best to explain the different types of nurses as we go higher. So, I'm going to do things a little bit different than I did with the previous two roles. I did talk about their degree. So for the advanced practice registered nurses, they can have one of 2 degrees. So we're going to talk about the advanced practice registered nurses first, and then I'll go into the degrees. So your advanced practice registered nurse, the acronym for that is APRN. So you may see an APRN behind someone's name, and if you did and you didn't know what it means, now you know what it means. It means Advanced Practice Registered Nurse. Now, it is very important that you keep in mind that this is a role. This is not a degree. Okay? So, APRNs are nurses who have a graduate level of education. It could be either a master's or a doctoral degree program in addition to clinical hours. Okay, these nurses are going to have more responsibility than the RN. There are 4 types of APRNs. Okay, trying to get that ring light out the way. So there's one. The first one is going to be the nurse practitioner. Second one is the clinical nurse specialist. Third is the nurse midwife. 4, nurse anesthetist. And I have the acronyms out by the side of each one. So NP for nurse practitioner, CNS, clinical nurse specialist, CNM for certified nurse midwife, and then CRNA for certified registered nurse anesthetist. Okay? Let me get that ring light out the way. So these are going to be your APRNs, and these are going to be a level above the RN. So we've talked about LVN, RN, and now APRN. Now, let's go into the master's and doctorate degree programs that a nurse can be, because not all nurses who have their master's or doctorate are advanced practice registered nurses. So we're going to talk about that next. Okay, so in the previous little clip, I think I said we're going to talk about the different degrees. Well, we are, but I want to give you all just a little bit rundown on each type of the advanced practice registered nurses. So first, we're going to talk about the nurse practitioner. Again, the advanced practice registered nurse, this is a role, okay? So for the nurse practitioner, this is a role. They can get either their master's degree or their doctorate degree. Master's is going to take between 2 and 3 years, doctorate between 3 and 4, depending on if you're attending school on a full-time basis or a part-time basis. I got my doctorate and I did mine in 4 years because I went part-time. So that is what makes them advanced practice, because of the advanced education. And in addition, there are clinical hours, okay? So there are currently 211,000 NPs that are currently in practice. And the nurse practitioner can assess, order, and interpret x-rays and other lab tests, prescribe medications, create plans of care. And there are going to be 6 patient populations. So under the nurse practitioner, someone has to choose, which kind of nurse practitioner they want to be, right? So they could do family, which is what I did, and that is the nurse practitioner who can see everyone the entire lifespan, from babies all the way to older adults, including women, okay? Pediatrics, and with pediatric, we can choose between primary care or acute care. Adult gerontology, this is going to be adults. Again, with this specialization, you can choose to be either a primary care or acute care. Psychiatric, mental health, neonatal, and women's health. The average pay is going to be $117,670, but a nurse practitioner could make up to $170,000, probably even more. It's going to depend on what area they're working in and their geographic location. So this is your first type of advanced practice registered nurse, or role, the nurse practitioner. So let's talk about the others. Okay. The second type of advanced practice registered nurse is going to be your clinical nurse specialist. There are approximately 89,000 of them practicing, and they can either have a master's degree or a doctorate degree. And I highlighted some of the most common areas that you may see a clinical nurse specialist working. Their ring light. Cardiology, oncology, neonatal, what is that? OB-GYN, peds, neuro, and psych. So they work to improve outcomes regarding patients, nurses, and system-wide organizations. They can take on supervisory roles, and a lot of times they provide direct patient care. Sorry for their ring light. It's really bright. They provide direct patient care. They are going to consult with and teach nurses and staff, They lead evidence-based projects, and they precept students as well. They're going to make on average, according to the Bureau of Labor Statistics, $114,993 a year. But I read that they could make up to $167,000 a year. So this is your second type of advanced practice registered nurse. Again, this is a role, the clinical nurse specialist. And we have two more APRNs to talk about. Okay, the third type of advanced practice registered nurse is the certified nurse midwife, or CNM. There are approximately 18,500 of them practicing in the U.S., and they can have either their master's degree or a doctorate degree. The nurse midwives are going to provide prenatal and gynecological care to normal, healthy women. They deliver babies in hospitals, private homes, or in birthing centers. And they also provide the follow-up postpartum care. They can work independently or with a healthcare team. They're going to make on average $112,830 according to the Bureau of Labor Statistics. But they can make up to $166,000 based on something that I came across. So your third type of advanced practice registered nurse is a certified nurse midwife. Let's talk about the last one. Okay. The last type of advanced practice registered nurse is going to be your CRNA, or your certified registered nurse anesthetist. There are approximately 44,000 CRNAs practicing, and as of January 1st, 2022, these programs are only doctorate level programs. So they used to be like the other APRN programs where you could attain either your master's or your doctorate. Not anymore. The CRNA programs are only doctorate level programs as of January 1st, 2022. Now, there may be a couple of more programs or like a few that still have masters, but the students who were already enrolled in them, they were grandfathered in. So once they graduate, their school will no longer have the master's level program. Okay, so what do the CRNAs do? They're going to administer anesthesia, monitor patients' vitals while they're in the OR, and they're going to see their post-op, see them in their recovery while they're recovering from the anesthesia. They're going to make on average $195,610 according to the Bureau of Labor Statistics. But CRNAs can make up to $400,000. It's going to depend on their experience and their geographic location. And so CRNAs are going to be your highest paid nurses. $400,000? Yeah, they're definitely the highest paid nurses. So those are going to be our advanced practice registered nurses, okay? Remember, we have the nurse practitioner, the clinical nurse specialist, the certified nurse midwife, and then your certified registered nurse anesthetist. Now, let's talk about some of the other types of nurses we can have with a master's degree, and then a little bit later, we'll talk about the doctoral degree nurses. Okay. So let's talk about the Master of Science in Nursing degree. So this is the degree. These are the roles. Okay. So the MSN is going to be 2 to 3 years after a Bachelor of Science in Nursing, after a BSN. Okay. So the APRN, we just talked about the 4 of those. Someone can get their MSN in administration. They can get a combined MSN and MBA in education, informatics, executive leadership, and health policy. I put some of the average pay alongside some of these roles, and a lot of these roles are going to set someone up to work upwards into leadership, and administration. But here are some, and these are some of the most common roles that someone could partake in once they get their MSN. Okay? Next, we're going to talk about the doctorate level of nursing, and there are two different types. So let's get into it. Now, let's talk about the Doctor of Nursing Practice degree, or the DNP. Now, the DNP is a degree. It is a practice-based degree, hence the name. Now, this degree is going to take someone between 2 and 4 years. For a nurse who already has her MSN or her Master of, or his or her Master of Science in Nursing, they can get their DNP in 2 years of full-time study or 3 years of part-time study. For the nurse that has their BSN or their Bachelor of Science in Nursing, they can get their DNP in 3 years full-time study or 4 years part-time study. I did mine in 4 years. So the DNP is a terminal degree. It's one of the terminal degrees of nursing. That means this is the highest degree. There's nothing above it. There's no higher education that a nurse can get. Okay? And one of the main purposes of this degree is to improve outcomes, right? And so there's additional focus placed on nursing leadership and administration, as well as the analysis of evidence-based practice for application. Okay? So we want to take research that has been evidence-based to improve patient outcomes, and we want to implement that at the head of the bed while we're treating patients, while we're diagnosing patients, and things of that nature. Okay? So someone who has a DNP, they're able to specialize, their career based on their career goals. So they can be a APRN, Advanced Practice Registered Nurse, which we already discussed those. They could be an educator. They could get their DNP in educational leadership and executive leadership or professional leadership. And these specializations are going to vary from school to school. So let's talk about our final nursing degree. So the final type of nursing degree is the PhD, or the Doctor of Philosophy in Nursing. Okay? So this is a nurse scientist. Yes, that's right, a nurse scientist. These nurses create research. This is a research-based degree. It's going to take between 4 and 6 years. And there are no clinical hours like there are in the Doctor of Nursing practice, the DNP, right? The PhD, no clinical hours, but a lot of learning how to research and grant write and things like that. Okay? So yes, this is going to prepare nurses to work in academic and research settings. And their final project, so I did mention this, but in the DNP program, the candidate is going to have to do a capstone project. Well, in the PhD program, the candidate must do a dissertation. And this is going to be cumulative, everything that all of their research. It's going to be between 100 and 300 pages. That's going to be their final project, okay? And some specializations, that someone with a PhD in nursing, they can get it in nursing education, interdisciplinary health, leadership, healthcare administration, population, or community health. So someone with their PhD can work as an independent consultant. They can work in universities. They can work in hospitals. They can work in health departments. They can work in a lot of different areas. And, they really are going to help implement changes in quality improvement and in nursing systems. So that's pretty much all. I do want to just talk a little bit about the differences between the MSN degree and the DNP, and then the DNP and the PhD. If you made it to this far in the video, you are the real MVP, okay? And thank you for hanging out with your girl. So, there are a couple differences between the degrees that I have listed. So the MSN, or the Master of Science in Nursing, and the DNP, the Doctor of Nursing Practice. Someone may say, oh, so you can be a nurse practitioner and have a master's degree or have a doctorate degree? Yes, absolutely. So they may be like, well, why would I want to get my doctorate degree when I can just get my master's degree? And that's a fantastic question. And I would say, it really depends upon your personal goals. I decided to get my DNP because the type of person that I am, I knew that if I got an MSN, having the DNP option available, I would want to go back and get it. So that's why I just did a BSN to DNP program. I didn't even want to go for my MSN because I didn't want to stop and then have to go back to school. I just did it all in one shebang. So the length of study is going to be different. The DNP is going to be longer, of course, because it is a terminal degree. A master's program is not terminal. It depends on your personal career goals. So the DNP, you're going to do more clinical hours. I did 900 clinical hours. It was close to 1,000. And then we learned about system thinking, which is essentially is going to lead to leadership roles in your career. You're going to start out making the same, but having a DNP, you can leverage that experience and work your way up into leadership roles. Now, the DNP, the Doctor of Nursing Practice, and the PhD, Doctor of Philosophy in Nursing. Both of these are terminal degrees. One is a practice terminal degree, one is a research terminal degree. So the DNP is going to focus on the leadership abilities for clinical practice, okay? So the DNP is going to be the clinical expert. That's why there are so many clinical hours in those programs, especially in the APRN programs. And now the PhD is going to focus on theory, analysis, statistics, and grant writing, research design, and research methods. So these are some of the common differences. You may say, well, what's the difference between a PhD and a DNP? I'm going to do a whole video on that, but these are some of the most common. Okay, so I hope this video helped you all. I hope it gave you clarity on the different levels of nurses, the different types of nurses, the number of years it takes to get these degrees, the certifications, the amount of money that these nurses can make. So nursing is a fantastic field to get into. If you were questioning or wondering, there's so much you can do. I mean, you could go from working in nursing homes to working in schools, to all the way to working with pharmaceutical companies, working with the government. I mean, the options are endless. So if you have not subscribed, please subscribe to my channel. I am still growing my channel. Thank you to those who have subscribed. Thank you for watching this video. Please share this video with someone. I hope it helped you. Until next time, be blessed and take care.